So hello and good afternoon, good evening to everyone who's joined us for today's webinar. I'm Bharat. I'm the CMO at Trackerwave. And basically through a series of webinars, we hope to share a lot of knowledge to our participants, insights into how modern day technology is being used and being put to good use in hospitals to help them gain operational efficiency. Uh, and a quick introduction about Trackerwave, who is organizing this webinar. Trackerwave is the market leader in implementing RTLS and IoT systems for hospitals in India. 8 out of 10 corporate hospitals in India use Trackerwave technology today, and we are expanding to markets outside India as well. We're really happy to have you all join us today, and we promise some very insightful content today because that's the kind of experience that our speaker today brings to the table. Uh, so I'm very happy to introduce you all to Jatin Grover. Today, Jatin is a senior technology leader in Max Healthcare. He's gifted with the ability to understand technology at various levels, solve real-world problems using the right technology and tools. We've had the privilege of working alongside Jatin while implementing our solutions at Max Hospitals. He's been instrumental in providing very valuable insights to us, using RTLS and IoT solutions to solve the challenges that he faces in his day-to-day work, and he has achieved amazing efficiency. So we requested him to share this knowledge and experience from this journey, and he's been so kind in accepting to do so. So thank you so much, Jatin, for your time today. And with this, I will hand over to Jatin to talk about how RTLS and IoT can transform hospital operations. Jatin.
Thank you, Bhardwaj, for a quick introduction. And I'm honored to have myself on board for this first webinar of Trackerwave. Thank you so much for giving me an opportunity to able to, tell other people across the industry who are a healthcare facilitator or a healthcare provider so that they can use best out of IoTs and RTLS system. So it's been a good journey from last, I think, 2.5 years we are associated with you, and we are a chain of around 20-22 hospitals. Okay, so coming back to my profile, so I am associated with Max Healthcare for almost last 6.5 years. And for everyone, Max Healthcare is the second largest chain of healthcare hospitals in India with around 4,000 beds across various regions spread it across various states in India. So we have around 22 hospitals spread it in majorly north region, combining with one in Maharashtra, one in Uttarakhand, couple of more acquisitions coming up on the way. So I am currently working in the capacity of senior manager in Max Healthcare and looking out for various verticals including IoT, HRMS, LMS, legal compliances, digital automation, along with the low-code developments, along with my teammates. Talking about my company, so we are, like I said, we are 4,000 plus bedded hospital. So we have a census of 4,300 beds currently spread across 20 facilities in India, majorly in the metro cities, so that we can cater most of the patients from the domestic patients as well as the international patients. So we have patient diversities from various regions, various areas of the countries coming down to India and getting their treatments done and successfully getting their treatment done with various specialities. Moving on to the main strategy of our organization, and then we'll quickly jump to the RTLS and the challenges that we are facing, that why we implemented, the Trackerwave solutions in various verticals. So the main strategy, the currently our CEO, Mr. Abhay Soi, has is to have, the best patient experience for any kind of category of patient, be it CGHS, be it PSU, be it, domestic patient, be it an international patient, provide the best of healthcare facilities. The main reason, to impart this technology is to improve the patient experience. So as we are expanding, new merger and acquisitions are happening, more number of beds are getting added, more, towers or more verticals are getting added day by day. So we want to leverage the technology to utilize it to maximum capabilities and, provide best of the healthcare facility across the patients in various regions. So with this, we can move down directly to the challenges which we faced initially before the technologies were leveraged into our healthcare industry. So it's been like a good journey of 2.5 years where we identified various challenges, where I'm listing down few of them. I think you can also relate at your healthcare level. So the major challenges that we could see is the shortage of the manpower. So though we are increasing with the number of beds, though we are increasing with the number of acquisitions, number of units, the manpower crunch remains the same for all the units. So when we talk about shortage of manpower, we means the number of patients are more, the manpower supply or the manpower for serving the patients, be it GDAs, be it nursing, be it any kind of resource, be it steward, F&B, everywhere. The shortage of manpower keeps on coming because of the attrition rate. Though HR team is they are currently looking into the iteration to reduce the number of people getting exited, but still we have shortage of manpower to cater the patients. So this is one of the main challenges because of which we need to optimize the current manpower available at our hospitals so that we can use best of our resources and can provide best satisfaction to the patients. Then moving on to the next challenge is we want to increase the patient satisfaction. So that plays a key role. That's also a vision of our CEO that we should have a maximum satisfaction of the patient at any levels, be it in the in the vertical of patient transport, be it in the patient procedures, be it in any kind of radiology test, be it in the terms of billing, TPA test, discharge, admission, online appointments, in any aspects. So we were not having any mechanism to track down any kind of request coming for patient transports, patient movements, patient admissions. So this was a major challenge that came up when we expanded our the chain of healthcares. So in order to address these, we were not having any insights, we were not having any analytics, so that we can plan it in such a way that the manpower optimization can be done. There can be people deployed at some of the places which are there with us but are not working efficiently, or we are not able to trace them anywhere despite they are with us in the location. So these were the key pain areas because of which we wanted to have some technology through which we could utilize and leverage the technology for RTLS and IoTs in our healthcare solution. So when we talk about RTLS and IoT, I'm sure you must be aware of all these terms by now. I think it's a trend in the industry. So for RTLS is basically a real-time location, system that enables you to track down the resources, be it your assets, be it your people, be it your equipment, be it your sensors, anywhere across the floors, across the unit, across the building. So you cannot escape it out from any of the places. So people or the manpower tend to, hide or tend to um, escape them from catering the patient request. This technology leverages so that we can trace down and can optimize the manpower at the maximum level so that the patient experience and patient factor is taken into the consideration. So when we talk about RTLS, for achieving the real-time location system, we need to implement IoT. So once we have IoT systems in place, that can leverage you to use basically all the technologies, and then we can have devices interconnected from various parameters that will cover up in the next few slides, be it your access points or routers or beacons, that helps you track respective manpowers, assets, sensors, etc. across the building. So why we chose RTLS and IoTs for hospitals, I'll let you know. So right now, the main challenge was to find out the available resources. Despite we were having resources allocated for various floors, various blocks, but still we were not able to utilize them properly. We were not having any capabilities to measure and improve that how many requests are coming in a day for patient transport, how many of them are coming for the patient discharge, how many of them are coming for a GDA request for serving patient for water supply, or it can be a linen change, it can be a uniform change, it can be doing the urinal activities. We were not having any measurements of all such activities so far. So we didn't have any task management thing that we should be able to track it in the system or any alerts or any escalations. We were not having any documentation to be presented to JCI and NABH audit, which plays a crucial role in terms of healthcare. I'm sure everyone must be aware about JCI and the NABH audits. We were not having any real-time monitoring of resources, where they are, how much they are performing, what is their performance, on what basis that we should give them um, rewards and recognition. We were not having any actual data on the ground. So all these imparted us to move toward RTLS and IoTs, which is currently running in almost 13 locations in Max Healthcare. And we aim to have 4 acquisitions in the current year, and we'll definitely try to implement the same in the current scenarios for all these hospitals as well. So once you identify that, yes, this is my pain area, like we did. So we identified what is the pain area for one of the hospitals, and then we started implementing it across the units. The technology plays an important role. So first, when we talk about the IoT layer, so it comprises of various tags that identifies that what need to be tracked, whether it's a patient, whether it's an asset, whether it's a device, whether it's environmental settings. So we need to first identify which technology will be used for identifying which category of user. So for patient, we might use patient tag. For asset, we might use asset tag. For location sensoring, there will be another tag. So we have to identify all such points which would be covering up in the real-time location services. Then comes in picture the BLEs and the Wi-Fi routers. So here it act as a mediator between the asset tags as well as the software that is deployed at the end and the cloud. So Wi-Fi is the middle layer that act as a network infrastructure layer, which transmits the data from the patient tag to the backend software for performing various algorithms. That is then thereon integrated with our HL7, EMR, and HIS. So any kind of integrations happening for patients, any kind of integration happening for any kind of test that is happening. So all of these are getting happen, with HRM, with our HIS and the EMR solution with HL7 integration. All of these were implemented under the security governance team, which is properly foolproof, because since we have patient sensitive data, so several rounds of security assessments have been completed and conducted with various VAPTs and various SOC 2 type reports that were provided by the Trackerwave team, which plays a crucial role when we go and finalize any solution which stores or transmit the patient data. So in our case, we were using routers or IoT gateways you can refer to for Meraki, which acted as a beacon also. The beacon, when we talk about beacon, so beacon is nothing just a location-based tracker, which allows you to track various kind of touch points, be it asset, be it patients, be it when you talk about the child, when we talk about mother and child, when you talk about the GDAs, when we talk about the porters. So BLEs are basically a low code energy, the Bluetooth low code energy devices, which transmits the signals and tells the, sorry, which tells the real time location of that particular asset. I'm sure you will be able to relate it once you start deploying it at your units, and once you assess it at your end, and what kind of infrastructure you guys have at your particular unit, because this plays an important and crucial role while we provision the things at a particular unit. Moving on from the infrastructure to transforming the operations in a particular journey, we deployed various solutions in a sequential manner, because at first we also wanted to have a assurance that everything will go as per what we have envisioned. So we have currently 4 modules running right now. One is porter management, one is digital queue management, one is asset tracking, and then the last one is environment monitoring. So I'll give you a quick introduction about all these 4, and then we'll move to the porter management in the detail. So since it says the name is self-explanatory that it's a porter management. So porter here refers to the person who transfer patients from one end to another. So patient transport can happen from anywhere. It can be a transport from admissions to the ward, or it can be a transfer from ward to a radiology test, or from a radiology test to another radiology test and back to the ward. Or it can be again from emergency admissions to the ICU, then ICU to the OT. All of these comes under the purview of the portal management. Then when we come about digital queue management. So again, it's an essential part of the healthcare industry where patient comes up for various kind of OPD treatments, various kind of preventive health checkup plans. So we wanted to ensure that patients spend as minimum time as possible in the hospitals. So if we talk about an OPD or if we talk about any healthcare packages that were happening initially, where we had to guide the patient manually to go into different tests based on the crowd. With this system, we can, yes, vouch that the at the end, the time for the patient journey would reduce by 1.5 hours when we go with the digital queue management system. So if we talk about any package or a preventive health package that is happening for a visa related test or any government related test, so it would allow me to get the entire package with around 10 or 12 tests along with doctor consultation done with the help of RTLS and IoT in a minimum time span of 2.5 hours instead of 4.5 hours. So reducing the crowd at my hospital, reducing the patient wait time, empowering my patients to have the free room allocation so that whichever room is free, they can go for that particular test and then they can reduce the overall time of their journey. So entire queue management plays an important role in the patient experience for various OPDs, preventive health checkup programs, for IPs as well, to automate the queues at various procedures, various levels across the hospital. Coming to the asset tracking, so we were having again a major challenge of tracking such assets which are crucial and important for patients, be it patient movement, be it for any equipment that were deployed at the patient site. So let's take an example. If we have wheelchairs, we have around 100 wheelchairs placed across the hospital. And if I want to use it for the patients, I'm struggling to find out the wheelchairs at one particular location. So with this module, we can simply try searching out the assets and we can simply search it on the floor plan by locating it on like the way we do it for uh, the Google Maps. Same way we can track our assets inside the respective floors of the building. Coming on to the environmental monitoring, we have come up with a noise monitoring solution which captures, which uh, hears out the voice around the network, around the surroundings, around a particular nursing station or around a particular ward, and presents a report along with a real-time LED panel showing the current sound decibels displayed at the nursing stations as per the WHO standards, which is around 35 to 40, so that we can reduce the noise in such critical areas and meet the guidelines of WHO. So earlier we were not having any such solution. We were not able to trace down that how much noise or how much sound is happening at respective nursing stations. So with this sound panels, with this environment monitoring module, we were able to reduce down a lot of noises, a lot of nuisance which were created by GDAs, uh, by the internal staff, by other users, or by the patient's attendants. So we were able to reduce down to half of them meeting the WHO standards. So these were the four key products that we have currently envisioned and implanted and implemented at almost all 12 locations of Max Healthcare. I hope this would also help you guys identify the the pain areas, also identify the usage across the hospitals. There are a lot many other modules which Trackerwave is offering, which we continuously strive to have it in our system also. But as and when we keep on moving, we keep on adding more units, more modules, and more utilization of the tool. So now we will try to deep down into the porter management currently being used across all my units, which may have a lot of transport related things, a lot of patient movements, asset transport, be it any kind of transport related to patients, assets, blood, samples, etc. So currently we are using room service deliveries. We are using porter management for pharmacy transport. We are using it for the patient movement. We are using it for the blood transport. We are using it for the transport of assets, as well as transferring them from the admission desk to the wards or wards to the main porch at the time of discharge. So all these movements of patients or assets or any kind of commodity happening in our ecosystem is happening through tracker waves, IoT and RTLS. So when we talk about pharmacy, when we talk about patient movement, all of these are stored, captured, monitored. Various alerts are happening, various escalation metrics have been identified, various things have been planned in order to monitor all such activities at a single dashboard. When we move into the next slide, we will be able to, explain you more into the insights that why porter management was, an important factor that helped us to identify and optimize the manpower at various hospitals. So I'm just sharing a high level bottleneck. I'm sure each hospital has their own infrastructure, each hospital has their own SOPs, each hospital has their own workflows happening. So this may vary hospital to hospital, but majorly across our ecosystem, we faced these challenges based on which we incorporated porter management. So earlier, before porter management, we were not having any efficient way of resource allocation. Since we were not having any system, we were simply identifying whosoever was free. We were identifying, allocating, and asking them to drop the patient. Due to which it was leading to overburdening of few resources rather than resource optimization or resource allocation to a uniform level. Earlier, we were not able to capture any TAT. We were not having any turnaround time for any kind of transport request happening at the patient's end. And that too cost a high transfer rate or a high duration when we talk about the end-to-end transport. So we were not able to cater the request in less minimum time, which suffered, which caused high number of patient complaints. Patient satisfactory response was going down in terms of patient transport, be it in terms of radiology, be it in terms of normal patient transport, and thus increasing the patient wait time. Earlier, we were not having any mechanism to capture any kind of, data, any kind of records or logs where we could track that which resource has done which activity for how much duration, for how many hours they were occupied, how many hours they were idle, hourly, the entire shift, how many breaks they have taken. We were not having any such accountability. We were not able to identify where the staff is right now, whether he is doing a patient duty, whether he is on a tea break, whether he's on a lunch break, whether he is hiding somewhere, whether he is moving out of my hospital premises after punching in. We were not having any such, you know, staff identification at any point of time. So all of these were a lot of bottlenecks are also there. Other than this, I'm sure you will be able to relate it when you identify and you are the subject matter expert for your own hospital. So I'm sure there are a lot of other bottlenecks also that may come up when we see on the ground reality. But all of these, to be very honest and very upfront, these helped us when we switched to the RTLS solutions from Trackerwave. So moving on to the detailed porter management thing, I'm just basically displaying it as a floor plan that gives me a holistic view of one of the floors or one of my hospital where I can see asset movements, various porters movement, various staff movement across the building along with their idle or assigned status at the current floor plan at any point of time. So I need not have to call up any person at any point of time. I simply have to log in into the floor plans. I can simply trace down any kind of resource, be it asset, be it people, be it a blood sample. I just simply have to go to the floor plans. That's the only way that I can easily track down the porters or the assets. So what we did was, along with the RTLS team, Trackerwave team, we mapped the entire floors of our hospital into the system, and basis that various hardwares to track all such assets and assets as well as the GDS beacons. So this was the first activity that we did, and based on which we were able to achieve the real-time tracking of various assets across the unit. Then comes into the picture is the Wi-Fi and the BLD power coasters. So we aimed not to provide anything to the GDAs on their cell phones, on their mobile phones, which could deviate them from the patient's delivery or patient service. So sometimes it happens that if we give them it on their mobile phones, they would keep themselves occupied in their mobiles and leave the patient unattended. So we also wanted to have a dedicated device for each of the resources, which can be only utilized just for the patient transport request, nothing else. So this device you can see is having a 3 inches display which shows my GDA or my porter that from where I need to pick up the location of the patient and where I need to drop them at a particular destination. So when we talk about the coasters, so it's again an IoT based handheld device that is a two-way communication device which does not turn off. It is linked to your Wi-Fi infrastructure and gives the real-time locations of your respective porters, GDA, to your respective housekeeping team, to your respective administration team throughout the day. When we talk about the coasters, it's simply the concept of the cab booking technology we use or leverage on a day-to-day basis. So as soon as we book a cab for any of the destinations, we get to have n number of drivers and cabs assigned whosoever is the nearest to me. The same way, the same logic we have implanted in our hospital industry, that whenever a nurse raises a request or whenever a radiology technician raises a request for a patient transport, it simply identifies the nearest porter whosoever is near around the source and assigns that task to that particular GDA. Once the task assignment is done, this 3 inches display allows them to see that which patient need to be transferred from which source to which destination. Alongside, this also provides an auto tracking facility that as soon as I reach my source pickup, the status changes from various statuses are there. The status changes into various stages. Once the ticket is created, once the porter reaches there, once the porter is delivering the patient at a particular destination, all of these are getting monitored. You can any point of time search it on the floor plans and track the live location of the tracker given to the patients as well as the porters. So this enables you to capture and monitor the stats of various patient movements, various assets movement, any kind of transaction which is happening through RTLS. So we move on to the next important and interesting features of the tool that comes out to be a data and analytics. When we talk about analytics, like I said, we were not having any mechanism to track any such data, be in terms of total number of requests, be in terms of optimization of resources, be it specific to the number of requests that we have catered in a day or the time when the porters were busy or when the porters were idle at a particular point of time. We were not having any kind of, tracker or mechanism for that. But as on date, as we switched from the traditional methodology to to basically the RTLS and IoT technology, I can vouch on that at current locations we are receiving an average 45,000 requests a month only for the patient transport, with minimum transport time, which earlier was around 25 to 26 minutes on an average request from one location to another, which has come down to around 13 and a half minutes, hence increasing the patient experience and the patient satisfaction when we talk about the movements compared to the earlier traditional system. We'll deep dive more into the analytics when we talk about the outcomes, because with every system, when we put some, investment out of it, we want to expect an MOS, we want to expect some outcomes out of it. So when we talk about the outcomes after implementation of RTLS, there was an increase, of tasks that were handled by one particular person. So if there was a resource who was doing 20 tickets a day in a manual conventional system, which we are not aware was we are not confident on whether the data was correct or not. We have it on the digital papers that the request handled by a particular person has now gone up by 33%. So if it was doing, the person was doing 30 requests, now he's doing it around 41 requests per day in almost a span of 2.5 years in all the locations. So this has played a significant impact when we talk about the optimization of resource, which was going underutilized earlier before we used RTLS. When we talk about any implementation of RTLS at any new sites, it's hardly, some efforts that we need to put in because the interface is too friendly, the interface is too, easy, integrated with our patient data from HL7 integrations that also allow the end users to raise the request in the system to friendly with the system, and adoption increases within next 2 to 3 weeks. So initially it goes on with less number of requests, and as soon as we grow up in next 2, 3, 4, 5 weeks, within 2 months of time, you will have n number of tickets flowing through the system and all automated without any manual intervention. So with the system implemented at our hospitals within like 2 years of time durations, we have consistently reduced the TATs. We are consistently improving the performances of the total TATs being, utilized for transferring one patient from one place to another with a significant, you know, reduced time that helped to improve the patient satisfaction and the patient success when we talk about the turnaround time in case of monitoring. We also have placed alerts. We also have placed escalations. We have also, placed matrices in order to have governance in case if any particular task goes beyond a particular threshold, then we get WhatsApp alert, we have email alerts, we have SMS alerts so that none of the requests are going unanswered, unmonitored, and the patient is happy at all the times. When we are talking about the staff allocation, like I said before, if we were doing 10 requests before Trackerwave solution for any particular porters, we are now doing 14 to 15 requests per porter after the Trackerwave is installed and implemented at various units, hence increasing my staff allocation and staff optimization. It also helped me identify the number of staff that I require more or I want to reduce the number of staff for various other purposes, or we can deploy it in some other tasks if they are not, allocated for any of the tasks. So this also allowed me to identify the areas where we can reduce the staff and the areas where we could have more staff into the consideration at various hospitals. When we talk about the time taken for request, so earlier all our nursing staff, all our, the technology staff, all the technicians, radiology staff keep on communicating with GDS and the supervisors on the phone calls, which could, utilize their time to around 1 to 2 hours every day on just coordination with the GDS supervisors for allocation of GDS for patient transport. Now, with the implementation of Trackerwave, we were able to reduce it to, 1/6 times the current, the existing figures, which almost is like a minimal time spent over the call when we talk about the GD supervisor, that too in terms of high waiting time. So if we talk about the earlier times, it was like 2 to 3 hours spending over the phone and coordinating during the nursing hours. We have now reduced to 30, 35 minutes, 40 minutes per day at a nursing. So which would allow my nurses to focus more on patients rather than, working on the tasks which are non-critical and non-nursing related tasks. So I'll summarize the benefits which we as an hospital or an healthcare industry have witnessed, have noticed across various 12 or 13 hospitals. So this is an average count. When we talk about average task handled before the Trackerwave implementation or RTS implementation, it was nearly around 20-25 task per manpower, which we were, incorporating at that time. When we talk about the implementation of Trackerwave RTLS solution, we were able to achieve it more than 40 tasks per day with the same porter request with an efficient utilization and planning for the next days. When we talk about new requests or the new centers, when you implement the tasks, when you implement the RTLS for any new sites, so it goes beyond, 200 to 300 tickets per day within 2 to 3 weeks of time. And when we talk about the full-fledged system within a month's span, you can completely switch down from the traditional telephonic system to the digital automated RTLS system for request creation. So here HL7 also plays an important role where you can have an integration with your EHR or HIS solution where the patient's data can be quickly transferred from HIS to Trackerwave database using HL7 integrations. When we talk about the TAT, so the TAT also plays an important and crucial figure in this. So if we talk about the TAT earlier, when we were using the old traditional system, it was way more than 30 minutes, which have now been reduced to 11 to 15 minutes near around with a 43% efficiency, which we have quantified. That's a rough figure that we have quantified for last 3 months of data. So we were, you know, after 2 or 3 months, you will significantly see the drop in the total TAT, which could help you to have your optimization of the manpower across various floors, various hospitals, and thus you can have the optimizations, manpower utilizations at a better performance. Then when we talk about the allocation of staff, so earlier we were having 15 staff which were deployed only dedicated for the patient transport. After using it for 3 to 4 months, we were able to cut down those resources since the total time taken for a request reduced from 30-35 minutes to 12, 13, 14, 15 minutes. So we were able to utilize the resources more, and those 15 staff were converted to 10 staff, and those 5 remaining staff were deployed at some other site for some other work. So through this, we were able to allocate our resources efficiently and at the same time ensuring the patient experience and patient satisfaction is also increased. So this is all what our take is when we talk about, the implementation of RTLS at Max Healthcare. We continuously aim to improve the technology in discussions with Trackerwave team. The team is also inputting a lot of software changes, taking their feedbacks from multiple hospitals where the RTLS is running, and that also helps and benefits us as well as other hospital in case if there's a new development or new enhancement that happens. So analytics plays an important role at the administration part, which is the forte of this tool that helps you to optimize the manpower, that helps you to monitor the manpower at any point of time, hence increasing the patient experience. This is all our take for today for RTLS being implemented at Max Healthcare.
Thank you so much, Jatin. It's truly engaging and very insightful, wonderful presentation. Thank you so much again. I think we have a few minutes to take some questions. I request all the audience to use the Q&A tab to type questions. Jatin, I think we already have our first question. What is the impact on patient satisfaction? Please provide some of your insights from your experience.
So I'll quickly give you an example of patient satisfaction. If we talk about a patient being taken to urology or, if we talk about the patient being moved to the ultrasound part, if the patient's bladder was full and we are finding a resource who can take that patient to the radiology for getting the ultrasound done. So that was a chaotic situation at my end. If the time taken to transfer that patient increases, the families or the attendants keep on creating a chaos at the end users. So with more manpowers, with more, with minimum efficiency, with the minimum, utilizations of resources with minimum TAT, we were now able to transport the patients to the respective destinations. When we talk about the ultrasound, when we talk about the X-rays, where the waiting time is high. So this increase the patient experience when the transport happens with the minimum amount of time. And that happens only when we have the manpower utilization. And then that comes only when the TAT is reduced. So that played an important crucial role when we talk about getting the patient not just from admission to the ward or ward to any other ward. When we talk about the transfer from ward to radiology, that also plays an important role in terms of the patient experience. So if you provide them the fastest delivery, that's all what you can do for the patient to have them the best experience in the industry.
That's great. We have another question from Jiva, who's asking, what are the feedback from the nursing and medical users?
So, like I said, it takes 2 to 3 weeks for a software to settle down because since everyone is habitual of picking up a call and dialing directly to the supervisors. But trust me, initially it would be a training that would be required simply for the nurses and it would ease out the life of nurses when they use their systems. We continuously aim to improve the user experience of nurses so that with few steps only they can simply raise the request in the system. When we started 2 years back, we were having around 5 steps for creating the request. When we end in this year, we will be having just two steps for raising the request simply by scanning the QR code of your nursing station and picking a transport request directly from that pick list. So it will save minutes of time, from the conventional Trackerwave solution, which we were earlier using for nurses just for raising a ticket request. It was just a handy because it's a QR code trend these days. Simply scan the QR code, choose the request from the pick list, and the ticket is created. That's all. You don't have to do any rocket science in that.
Amazing. That's game changing. We have another question from Karthik Manohar, who's saying, I see EMR integration is here. Is this HL7 based? If so, what transactions were integrated?
So when we talk about the transactions, it was admission, discharge, transfers, any kind of billing related to OPs, IPs, radiologies, all of such were integrated using the HL7 integrations.
Super. That's very insightful. We have the next question, which is how soon did ROI get achieved at Max Healthcare from Dokes Nilo?
So when we talk about the ROI, to be very honest, you can achieve that ROI within 1 year of time. Like I shared in my data, when we talk about reducing the resources from 15 to 10, so those 5 resources, if you tried utilizing it somewhere else, or you may, allocate them to some other resource, some other areas, you will be able to identify the ROI of the current CapEx and OpEx that you invest in the Trackerwave RTLS systems. So to be very practically, in the starting only, we were working on with 17 resources. Within 6 months of time, we were able to, take out 5 resources and allocate them into some other department and vertical, reducing it to 12 for manpower optimization. So the entire ROI we got, you know, uh, invested, whatever we invested in the RTLS solution, we got to have that ROI back in 6 months because we are also investing them in the terms of salaries, in terms of welfares, in terms of other activities that we prepare with staff. So all of these can be leveraged when we talk about the ROI for our TLS system. So it's just 1 year of capex with 5 resources. That's enough for it.
Fantastic, Jatin. That's spot on. I think we have one more question from Fadila. Uh, Based on your experience, what is the problem when you implemented RTLS for asset tracking, especially for medical equipment, since there's a lot of different kinds of medical equipment in terms of assets? Any challenges you faced? How did you overcome it?
I don't see any challenges because it's just a beacons. It's a tag that we need to place it on the hardware. Your entire infrastructure, your entire ecosystem is really enabled. Your entire infrastructure is Wi-Fi enabled. If your entire infrastructure is, a Meraki based infrastructure where it acts as a beacon as well as your Wi-Fi system, I don't see there is any challenge while implementing the asset tracking. That would help you identify your area's assets located across your units. I don't see we faced any challenge in doing so.
Okay. We have a couple more which have just come in. How has it made JCI reporting easier, compliance for audits?
So we were taking patient feedback. We were taking, we have all alternate solutions also apart from RTLS where we take the patient's feedback so that we can have such reports presented to the JCIs. Earlier, we were not having any kind of reports that give me a TAT monitoring, that gives me a real-time reports of capturing the TATs of each request, which allows me to have the resource optimization. So that helped me in having the digital reports, which was not authentic earlier. We were maintaining registers, we were having all such manually handling, so which created a lot of chaos at the end of patients and their families while we attend them in the longer duration. So all these data, all these analytics can be presented in the JCA and NABH when we talk about the audits.
Excellent. We have a couple of more questions coming in. What are the cybersecurity controls in place for IoT at hospital in IT system by Karthik?
So when we talk about the controls of cybersecurity, these are all internal policies that have been imparted by our security controls. This has nothing to do with the RTLS solutions. We at our hospitals have incorporated all such firewalls, gateways at our end, and securely integrated with the RTLS database so that the data of patients remain with a confined ecosystem and transfers through HL7 only.
Uh, Probably the last question. Is the tracking tags similar to an ad tag by Apple?
You can refer to that.
Yeah.
When you talk
So
about the
yeah.
floor plans, when you talk about the floor plans, you at any point of time open the floor plan, see various tags being placed, active, idle, busy. You can easily identify the track requests of particular tags at any point of time, at any point of locations, at any floors across the building.
And a follow-up question, how did you convince the decision makers at Max Healthcare that implementing RTLS is a no-brainer?
So, to be very honest, we did a POC initially because it was new for us. It was a new technology for us. We did a POC for around 1.5 months with Trackerwave team. We implanted few beacons. We implanted few coasters at a particular floor. We tested it, and at end of the month, with the help of analytics, we could show up the overall TAT with a reduced TAT as compared to other floors, which could help us make a comparative analysis to implement the system at all the units.
Okay, I guess we have one more question, Jatin, and then after that we can wrap it up. I know you have a hard stop to for your next this thing.
Yeah.
Is connections are done via Wi-Fi only, or is there a minimum requirement for your Wi-Fi speed infrastructure? What if your Wi-Fi goes down?
So if our Wi-Fi goes down, we talk about, can you hear me?
Yes, very much. Yeah.
Yeah. So in case if the network goes down, in that case, we can still raise the request, but at that point of time, we will not be able to trace the real-time location of that particular JDS or porters across the building. But yes, we can create the request inside the building. We can have the request catered in the system, but yes, we will not be able to trace down those GDS or porters across the building. That yes, we are dependent on the network for that. That is the minimum requirement that we or any hospital should have, catered well in advance once we go live for RTLS.
I think those are the questions that we have, Jatin. I think thank you so much once again, for taking the time. It was a fabulous presentation. I'm sure everybody gained a lot of insights. And we've sent a feedback form as well. Please, participants, click it and give your feedback again. Thank you so much once again, Jatin.
Thank you, Bharadwaj, for having me on board and giving me this opportunity.
Pleasure is all ours. Thank you, everybody, for attending and taking the time today. We hope you all enjoyed and look forward to staying in touch. You can always write to us, and we will send you a link to the recording in case some of you want to review and understand any other points. But thank you once again. Over and out.